Select the drug which should not be used to treat neurotic anxiety and tension syndromes despite having anti anxiety action. Chlorpromazine. Chlorpromazine is ineffective in vomiting due to motion sickness. The following statement is correct in relation to diazepam and chlorpromazine. Both have anti anxiety action. Select the anxiolytic benzodiazepine that has additional mild antidepressant property. Alprazolam. Which of the following is a non-sedative anxiolytic? Buspirone. The following statement is correct about buspirone. It has an anxiolytic but no anticonvulsant or muscle relaxant property. Select the drug which relieves anxiety but neither reacts with benzodiazepine receptor nor produces any overt CNS effect. Buspirone. The major constraint in the long-term use of benzodiazepines for treatment of generalized anxiety disorder is possibility of drug dependence. The preferred class of drugs for long-term treatment of severe anxiety disorder with intermittent panic attacks is selective serotonin reuptake inhibitor, that is sertraline-like compounds. Choose the correct statement about the use of propranolol in anxiety. It suppresses the autonomic manifestations of acutely stressful situations. The following drug of abuse is a hallucinogen, that is cannabis. Which of the following is a selective MAO-B inhibitor? Selegiline. The non-selective MAO inhibitors are not used clinically as antidepressants because of their high toxicity and potential to interact with many foods and drugs. Which of the following MAO inhibitor is most likely to produce cheese reaction? That is tranylcypromine. The following is a reversible and selective MAO-A inhibitor, that is moclobemide. Cheese reaction in a MAO inhibited patients manifest as hypertensive crisis. Choose the correct statement about moclobemide. It is a reversible inhibitor of MAO-A with short duration of action. Imipramine given to non-depressed individuals produces lethargy and light-headedness. Of the following, choose the antidepressant having both sedative and high anticholinergic activity. Amitriptyline. The antidepressant which selectively blocks 5-hydroxytryptamine uptake is fluoxetine. Imipramine produces the following actions except euphoria. Adaptive changes in brain monoamine turnover due to blockade of noradrenaline or 5-HT reuptake is credited with the following effect. Antidepressant. The mechanisms involved in the causation of dangerous cardiac arrhythmias due to overdose of tricyclic antidepressants include the following except increased vagal tone. A 65-year-old man was brought to the hospital with complaints of pain in lower abdomen and not having passed urine for 16 hours. The bladder was found to be full. His son informed that he was depressed for the last 2 years and only the day before a doctor had given him some medicine. Which of the following drugs is he most likely to have received? Amitriptyline. The following drug should not be used to treat tricyclic antidepressant drug poisoning, that is quinidine, digoxin, atropine. Limitations of typical tricyclic antidepressants include the following except low oral bioavailability. Tricyclic antidepressants abolish the antihypertensive action of the following drug. Clonidine. The following is a tetracyclic antidepressant that has additional dopamine blocking and neuroleptic properties as well as greater propensity to cause seizures in overdose. Amoxapine. The selective serotonin reuptake inhibitors have overcome the following limitation of typical tricyclic antidepressants, that is frequent anticholinergics, sedative and hypotensive side effects, and high risk of cardiac arrhythmias in and seizures in overdose.